To other news, Speaker of the House of Representatives says a strong legislature is essential to deepening democracy, implementing reforms, providing oversight, and ensuring accountability. Abbas Tajuddin stated this at the formal presentation of a parliamentary development program to the diplomatic corps, development partners, and donor agencies in Abuja. National Assembly correspondent Joke Adisa reports.
The Parliamentary Development Program is an initiative to strengthen legislative capacity and promote sustainable development across Nigeria. The initiative was conceived after the inauguration of the 10th House and had the support of the United Nations Development Program, UNDP, and other development partners. The program of action is now ready for implementation as the Speaker formally presents it to the public, including the diplomatic corps, local and international donor agencies. Mr. Speaker acknowledges their contributions to the nation's socio-political and economic development, particularly in such sectors as health, education, security, and governance.
As we present this program today, let us cast our minds to the critical role of the legislature in advancing the democratic and development aspirations of our dear country, Nigeria. A vibrant democracy rests on the strength of its legislature. As such, the Parliamentary Development Program is not merely about capacity building. It is an investment in the heart of our democracy.
High turnover of members remains a challenge to developmental democracy, with 281 of 360 members elected new in the 10th House. The expectation is that the program will boost the institutional capacity necessary to deliver on reforms in many sectors.
This initiative comes at a crucial time. The 10th House of Representatives has set an ambitious legislative agenda.
All the development partners through the UNDP renew commitment to supporting Nigeria's democracy through the parliament.
We will also draw on valuable lessons learned from the many years of working on parliamentary development, draw on best practices in the 170 countries and territories that we work in, and continue to be the support platform to advance the sustainable development goals as mandated to us by the General Assembly.
The initiative comes at a time the House has set an ambitious legislative agenda, which the Speaker says aligns with President Bola Tinubu administration's goals, as it seeks the moral and financial support of its guests. Joke Adisa, TVC News, Abuja.
To Enugu State, where the Ministry of Health has confirmed the outbreak of cholera in the state, with 10 casualties so far from the disease. Director of Medical Services, Enugu State Ministry of Health, Samuel Egwonwu, who spoke, says steps are being taken to contain the scourge. The state, however, places high alert on patients with symptoms such as severe diarrhea, abdominal cramps, and vomiting. It admonished the people to enhance infection prevention and control measures in their facilities and report cases promptly. The State Ministry of Health announced that it has initiated containment strategies in line with guidelines from the Nigerian Center for Disease Control. The State Commissioner for Health, Emmanuel Obi, outlines importance of preventive actions, including proper hand washing, use of clean water, and practicing safe food handling. Still talking health. In a bid to address future public health threats posed by antimicrobial resistance and also advanced genomic surveillance in the country, Nigeria's Center for Disease Control and Prevention has launched the National Action Plan 2.0 and the National Genomic Surveillance Strategy. TVC News' Kemi Balogun reports.
In 2019, Nigeria accounted for over 64,000 deaths due to antimicrobial resistance. It is projected to also cause more than 39 million deaths in the next 25 years. Due to these growing global health threats and many others like it, the Nigeria Center for Disease Control and Prevention is launching 2 documents to not only strengthen efforts to combat AMR, but also to improve disease prevention, early detection, and precision medicine.
The threats of AMR are not limited within our borders in either Nigeria or on the continent. The developed world also can be exposed to the threat of antimicrobial resistance that happens here. So robust financing mechanisms, we need to be serious about it in terms of global cooperation to support countries implement their national action plans.
So the One Health National Action Plan on AMR and the National Genomic Surveillance Strategy is a call to action, a signal that we are ready to advance beyond discussions and drive meaningful change on the ground. We must now focus on real-world implementation.
Both strategies are expected to, among others, guide and strengthen AMR governance at the national and subnational level, prioritize critical research for public health, enhance disease prediction and surveillance capabilities. The World Health Organization says it is committed to supporting Nigeria with all the necessary resources to defeat the challenges of antimicrobial resistance.
So we are happy that Nigeria is not among them, but it's also a call for the government, but also with support of partners to invest really in antimicrobial resistance and address the root causes.
Experts here believe this launch is an addition to the government's commitment of building a resilient and adaptive health system that can safeguard the health of its citizens and contribute to global health security. Kemi Balogun, TVC News, Abuja.